Assalamu alaikum. Now another MSK station. So presentation of hemophilic arthropathy. Today I have examined 10 years old John. On examination, musculoskeletal examination on the knee joint, there is found there is obvious swelling, but there is no redness on the right knee joint, and there is no tenderness, and there is effusion test is negative, and there is flexion deformity in the right knee joint. Left knee joint is normal in comparison to right one. And to complete my examination, and I found there is a bruise on his arm. And to complete my examination, I want to do the general examination where there in the eye there may be pallor jaundice, in the chest there may be portacate, in per abdomen there may be tenderness due to rectoperitoneal bleeding, and hepatomegaly may present if there is hepatitis. And I want to complete my examination, I want to do the vital sign anthropometry, leg length discrepancy, tenor staging, Piggles, and investigation. Differential diagnosis is maybe case of JIA, it may be case of sickle cell arthropathy. If we consider traumatic arthropathy also, if we consider it's a long extending arthropathy. As there is no pain here, only there is flexion deformity. Investigation if it is hemophilic arthropathy or hemathosis. So I will do the minimum investigation and full blood count. Hemoglobin level will reflect the severity of the hemorrhage, and activated partial prothrombin will be increased, and factor SA, factor 8 and 9 SA, and genetic test, and to see the complication viral markers, and also mixing test for factor 8 inhibitor is developing or not, and CT scan if indicated. And then management. For management, I will go through the multidisciplinary. I will take his focus history, review his previous note, and I will involve the multidisciplinary team, pediatric consultant, hematologist, orthopedics, genetics, physiotherapist, occupational therapist, psychologist, and so involve the school nurse and support group. And then for acute management and long term management. In acute management, for the pain, painkiller, paracetamol if morphine after consultation, and for the bleeding, tenexamic acid may be given, and to increase the factor 8 level, factor 8 supplementation, desmopressin, and if factor 8 is not available, so in this case fresh frozen plasma corticosteroid may be given, and recent treatment option is imicizumab. And long-term management is if as there is hemathosis is present, so lifelong prophylaxis along with the advice for this patient, and advice is lifestyle modification, avoid the contact sports, avoid IM injection, aspirin, NSAID, inform GP and dentist, educate parent about the nature of the disease, and subcutaneous hepatitis B and C injection. If there is antenatal diagnosis, so planning of the delivery with no forceps or ventouse, bracelet, and emergency care plan. And complication of hemophilia is hemathosis, intracranial bleeding, life-threatening bleeding. Another theoretical question may be severity, mild, the factor level, normal factors 8 and 9 level 50 to 150%. In case of mild hemophilia, level of factor 8 or 9 activity 5 to 25%, moderate 1 to 5%, and severe less than 1%. And complication other than the complication, we may say that there is a chance of development of the antibodies in the recipient blood against the infused factor 8 and factor 9. That time we will infuse the factor 7, and antenatal diagnosis can be done. So thank you. Assalamu alaikum.